Om Shanti, yes, ma'am.
Okay, let's start the session. Come into the sitting posture. Keep your back, neck straight, aligned. Relax your body. Go in your posture. Bring the alignment. Now, take a deep, prolonged, slow inhalation. Deep, prolonged, slow exhalation. Inhale and exhale. Now inhale through the Om. 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 Shanti. 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 Feel the vibration and sensation. Join your both palms. Rub your palms. Place on your eyes. Very slowly while blinking, looking at your palm gently, open up your eyes with a great smile and say Om Shanti. Om Shanti. So, welcome to the yoga therapy class. Now, in previous class, we discussed about the bone-related problems, arthritis, osteoporosis, then osteomyelitis, and other back-related issues. What happens if your tendons, muscles, fascia, and the bones gonna weaken? What kind of diet you can take? So in diet, I talked about that things which is you should take it and things which is you should completely avoid it, right? In arthritis, the yogurt should not be given to that patient, but rest of the problem like back related issues and osteoporosis, in that condition, you can take the yogurt, okay? But all product which is made of the yogurt and which is sour in the nature, that should not be given to the arthritis. This is the only one thing they have to consider. The diet remains same. Now come to the what kind of asana practice they can do, because you cannot teach them Ashtanga Vinyasa or the Vinyasa for flow to them. Okay, it would be very difficult because their bone structure already weakened, and if they do this fast movement, there's a break or there's a fracture in their bones, and inflammation gonna increase. So instead of those things, you can introduce the Sushmyan or subtle movement of the body. Pavan Mukh series you can introduce to them. So what are Pavan Mukh series? Like rotation of the neck to the one side, Viva Shakti Vikasa Kriya, this one. Then shoulder rotation, which we call Purnbhuja Shakti Vikasa Kriya, clockwise and anti-clockwise. These are the names in Sanskrit. Um, don't worry about it. But the importance is like each synovial joint would be you gonna you know um, make them activate. Okay. try to practice all those practice, which is basically working on joints. So Anglish Vikasa Kriya, this where your fingers would be very slowly, you have to push it down. So these practice, all the variation like this you can do. Then Kohani Shakti Vikasa Kriya, okay, where you are improving your capital joints, this area. Then Maniband Shakti Vikasa Kriya, the wrist movement, one by one. But whenever you're doing, make sure you have to give the instruction with the breath awareness. So like inhale, move, exhale, bring it down, like this. Inhale and exhale, inhale and exhale, inhale and exhale. So each joint, same with your lower body part, your back, your knee, your ankle, your toes, tiny toes also. All the movements, whatever movements are related to this, clockwise, anti-clockwise, flexion or dorsiflexion, plantar flexion, okay, extension, all the movements with related to the joints. Um, you should, or circumduction, like through your hip and through your shoulder you can make the circle. So these introductions, these practice should be introduced to these all kind of problems. Doesn't matter at all what kind of problems you are having. Even if you have the asthma, bronchitis, and other things, even to start, the before practicing the asana, you have to warm up your joint. So this is the warm up, um, you can say, practice which prepare you for the asana also. So you're not gonna meet with the injury, and also you are preventing many problems. Okay, so if you have the disease or not having it, you should focus on the movements of the joint, each joint, because many practice we don't focus on these joints, right? The tiny ones area. So this called Sushvyam or Pavan Mukh series. Okay, then come to the breathing practice. So I'll write it down for you. So breathing practice, understand. Pranayam should not be prescribed to everyone because there is lots of precaution one has to take. So safe practice which you can do, that is the abdominal breathing. First, second, chest breathing or thoracic breathing. Third, yogic breathing. Fourth, nadi shodhan. So these are the practice one should do. Okay, first, second, third, and fourth. Abnormal breathing where you have to inhale, I think you did in the pranayam class. So these are the four safe practice. Okay, anybody can practice these breathing. Nadi Shodhan is the pre-practice of the pranayam. Yogic breathing is also the pre-practice of the pranayam. Chest and abdominal breathing allow you to improve your diaphragmatic function and also improve your abdominal function. All the organs get the lots of oxygen, and deeply if you exhale you release the more carbon dioxide, so waste is completely released from the body, and this is the purification. You are deeper level doing the purification in your body. So these are the safe practice you can introduce to any problem. So journal, like, just close your eyes and just tell them, okay, whatever problem you are having, start these practice. Okay. So how many times? Like 15 to 20 minutes should be given to each breathing practice. And then come to the Shatkarma. Shatkarma cleansing This again, there is not in your course, but if you get the chance to do the offline course from Himalayan Yoga Association, we do teach these Shatkarma. That is again Niti Kriya, okay, Niti Kriya, then Kunjal. Kunjal is very effective for the arthritis. Then Shankpachalan Kriya should not be given because their bones are it gives tremendous pressure and we require the individual guidance. But Neti Kriya and Kunjal Kriya, Neti Kriya is a safe one, everybody can practice, but Kunjal Kriya, you require um, the observation of the teacher, right? So Neti Kriya and Jal Neti Kriya or the Ten Neti Kriya, this is two practice, Jala and Tela and Rubber also. Jala Nitikriya, Tela Nitikriya, and Rabada Nitikriya. So these all three are the safe, all kind of problems they can practice. But yes, these things you have to learn under the guidance of the teacher. But Nitikriya can be practiced by anybody. Okay, not much precaution is included. But Kunjal, Shankrachalam, other Shatkarma required the precaution. Now meditation, what kind of meditation they can do, though as I told you, these bone related problems mostly come psychosomatic or the stress related problems, and the stress and the psychosomatic problems basically directly or indirectly connected with the vata problem. So vata go imbalance in your body, and that's why you have these issues. So in this condition, what one person can do, so the active meditation they can participate like dancing or chanting pranam meditation which I taught you, then chanting the mantras, any kind of the mantras they can, to any mantra which they feel connected, they can chant. So these meditation they can practice when they are um, working on the balancing of the vata. So if the pain is psychosomatic, like in their back issues, back related issues or other related problems, then it will come out with the practice of the meditation. So these are the safer, practice for all the problems of the vata related and especially the bones, skeleton, your skeletal system related problems. Okay. So these are the general guidance for these issues. Now, write it down with another problem, the kapha related problems, kapha and pitta related problems. Okay. In this, you have um, in kapha basically asthma, bronchitis, upper and lower respiratory system problems. In this, you can have the sinus problem. Sinus are blocked. If I show you the picture, you get the better idea what happen if you get the sinus. Asthma is very common, and I hope you know about the asthma where your air windpipe is blocked because of the mucus, and then you feel attack during the attack of the asthma. The air is not reaching to the lungs, and there's might chance that they get um, lack of the oxygen to their brain and to their heart, and then they can die. So this is the sinus. When you have four types of the sinus in these areas, you can see the name of Melaxry sinus spectrum. Spectrum is the mucus in these area, ethmoid sinus and sphenoid sinus and frontal sinus. Sinus is basically the hollow space of your facial area this called hollow cavity, and in this, these basically regulate the air and maintain the temperature of the air. So when you inhale, air passes through these hollow space and it's regulate their temperature. Okay, but what happened when, because of the attack of the virus, because of you are allergic to something, your body starts producing more mucus. So mucus stuck in their hollow cavity, and then you get the inflamed. It's not coming out, and slowly it start affecting those area. It's happened even in the cold. Whenever you get the cold, this thing happen. So sinus, there is no permanent cure, but symptoms you can reduce. Yoga therapy definitely gonna help them. And if sinus is affected by the allergy attack or some other things, still you can cure these things through the opting the lifestyle and maintaining the diet. Then sinus, asthma, and other problems you can see, like cold if you get. So cold is the same thing. When you have certain problems, you get the blockage in your nostril, you get the throat infection. Okay, these are the issue happening. Now, what we can do in these things, even during the asthma, you get the constipation also. So when it's have cough, cough, you get the vat imbalance in your body. Because of that, also you get the asthma attack. Okay, and also you get the asthma attack with the kapha imbalance and pitta imbalance. So in asthma, airways narrow and swell and may produce extra mucus, and that cause breathing problems. Okay, and the symptom is shortness of the breath, chest pain, coughing, and wheezing attacks. Why do that get these attacks? Many people, because of they have the allergic to something, or non-allergic because they are working in the some chemical factory, that also can trigger out, or since childhood they are having the asthma, that also can be triggers, like generation to generation. So the airways is like small rather being the big hollow in this. So smoothly the airways is stuck or inflamed or not clean, and air is not passes smoothly and not reaching to the lungs, that can cause the asthma attack or asthma. Okay, so I'll show you the picture what happened in asthma, so it give you the clarity. So you can see the picture. This is the normal LA5, right, which is clean, but when it's swollen, it's swell and it's filled with the mucus. So how it's filled with the mucus? Because there's a cilia, there's a hair kind of thread which release the mucus in order to take out the bacteria. That's why whenever you got cold and anything, your body start producing the mucus in order to take out the bacteria. So mucus is good, but too much when it's produced and it's become hardened in and stuck in your body, then it causes the problems. Okay, once mucus is coming out, that's is fine. So we give the solution to according to based on these things. So first, I told you, whenever you get the mucus increase in your body, you have to remember the kapha diet which I explained you. In that you have everything is increase the kapha. So in that time you can opt the fasting mode, liquid fasting, take the and opt the vegan diet. So kapha diet you're gonna follow. Okay, other things which you can do about it, certain things you can take. um, try to take the fruits with the roasted fruits like pomegranate, and if you are giving them even the guava, roast on the fire little bit, remove the skin and then take it. Not try to burn it, just so it's gonna change the property of the fruits. And if you're taking the citrus fruit, because you require the vitamin C also in order to get the to reduce the inflammation and other things. So vitamin C is very helpful. So in that condition, you can soak the fruits lukewarm water, a little bit, little not very hot water, but lukewarm, and then for 5 minutes leave it, and then later on cut it, wash it properly, and then you can add black salt and black pepper into it, and then you can take it. Okay, completely avoid banana, rice, yogurt, any kind of milk product. Okay, not should completely avoid it. And they can have chana water, moong water, moong black, green moong soup, like pulses, green moong dal pulses. Okay, uska soup bana ke they can have it. So soup of the black pea, they can make it. That is also good for them by adding the black pepper, cumin, ajwain, ginger, garlic, and little bit turmeric. These things can be, these spices, more and less they can have it. Okay, but if there's a pet in, like they feel the heat, they get the fever. So in that time you have to take the cumin. Okay, just take the cumin. Not do not take the more spices because it's gonna increase your pitta. So these, and along this side, Giloy, so I'll write it down. Giloy tablets or Giloy quat. There's a plant that Giloy tea can be given to them. It's very good. Giloy basically working on the immune system. So upper and lower respiratory system problems, sinus, bronchitis, or if hay fever, any kind of fever, this Giloy work like a miracle. It's a miraculous effect, on the body. So Giloy can be given to them as a tea form, as a quath, as a tablet is also available in the market that can be utilized. Then, if you get the cold and sinus problem, even in the asthma also, it gonna very much effective. And even this kriya also helpful for um, the migraine. Tomorrow we're gonna talk about the mental problems, especially other things. But Nasse Kriya is very helpful for. This is a safe practice. Everybody can practice this Nasse Kriya. So, especially in the cold infection or even for cleaning the body, okay, Nasse Kriya should be practiced. So, evening, morning, and evening, if you get the attack, not attack, basically you are having the problems, that time you can take the Nasse. Nasse is like um, neem, that is a neem leaf you can put into the water, or ajwain you can put into the water, make it hot and take the steam. Okay, inhale it through the nostril. It's gonna clean your air pipe and it's gonna reduce. It basically release the mucus which is hardened in your the windpipe and which is not properly coming out. It's release it and then it smooth the mucus and then it's not come out, okay, easily. So Nasikriya, after that you can put the mustard oil in each nostril, 2 and 3 drops, and after practicing the Nasya. So morning and evening. And after doing the Nasya Kriya, do not go immediately out. Cover yourself. Take the 30 minutes nap. Relax your body, and then you can do the other things. Okay. So these things should be practiced in when you have upper and lower respiratory problems, any problems. I have just given you the few example, but if there's other problems also, you can give these. This is a safe idle practice, okay? But even in the COVID situation, same thing you have to do. COVID, if anybody get the COVID, same routine they have to follow. Okay, but yes, individually we give more other things, but this is the general things which you can, if even you don't understand, you feel like mucus is coming, cold is there, then give this treatment. Even if you do not figure out if kapha go imbalance or bath is going imbalance or the pit is going imbalance. If there's a symptoms, just give these things. Okay, start practicing these things. So now massage should be given to them in their head, in their leg, warm massage. The massage like with the hot oil and with the light hands you can practice, but not given during the fever time. But if you don't have fever, little bit one massage you can do on your chest area with the light hand, and then you can practice the Naksha Kriya. It relieves the mucus very easily. And then sun bath morning and evening time should be given to them. Sun is very good. It's basically balanced all the three dosha. But yes, pitta people also can take the sun bath, but light sun bath, okay, not too much, like 5 to 10 minutes is sufficient for them. So this is all about kapha diet. I already explained you in very much detail that they're gonna follow. Other things I have talked about it. Everything make increase the kapha, so fasting is good one. Then they can intake the honey also, the good quality honey. If they don't get the honey, take the jaggery. Okay, so jaggery should be given during this time. So these things they can have. Now the asana, what kind of asana practice we can go for it. So in asana, all the chest opening exercise, all the where you have to open your chest, like bhujangasana, all the variation of the bhujangasana, then all the variation of the camel, asana, camel pose, then peacock, then there is a chakrasana variation, then kati kriya, all the kati kriya where twisting is involved, right? And chest movement is involved, opening of the chest. So those asana they you can introduce, and it basically affect your upper and lower respiratory system. It strengthen these parts. Along with the asana, you have to introduce and with the hold. So if you are holding in the bhujangasana 5 second or 5 to 10 second, they have to do the chest breathing or the abdominal breathing. They also can do. So these breathing is basically give them the more open area to the lungs and more open to areas to their diaphragm. So they deeply inhale in that category, and then when you deeply inhale, your windpipe, your trachea, your airways, and your alveoli, your walls of the lungs, your rib cage, everything would be expanded, and then when you exhale deeply, it's same time contracted. The full oxygen you are giving to your system, respiratory system, and then it's strengthening. You are strengthening these areas, and then by strengthening it, you are reducing the even your allergy attack. Okay, like many people have the allergy with the pollen dust and other things, and they start sneezing immediately. So these things you can do, And yes, sun salutation, A and B, both you can introduce, but make sure their body would be capable to practice. Introduce with the lots of restorative types, like with lots of hold, slow flow, you can introduce slow hatha, you can introduce to them. And where lungs are expanded, all the asanas you can improve. You can make your own flow. Okay, you can introduce, you can skip the things which make your students uncomfortable. So these things you can do about it. Breathing, the safe breathing practice, which I have just told you, um, abdominal breathing is work like a miraculous. Abdominal breathing, chest breathing, these are the two. Diaphragmic breathing, then yogic breathing, then Nadi Shodhan, yes. Along with these side, Mandagati Bhastrika Pranayam you can introduce. Mandagati Bhastrika Pranayam, okay? Very slow version of the Bhastrika they can practice. Then Mandagati Kapalbhati also you can introduce. If there is Kapha and the Vata issues, very Mandagati, okay? Even Mandagati Bhastrika and the Kapalbhati can be practiced by the pit, but early in the morning, okay? Before sunrise, they can practice. So these things they can do. Shatkarma, again, Kunjal is very effective. Neti Kriyas, all types of the Neti Kriyas is very much effective. It's basically working on the upper respiratory system. Kunjal work on the lower respiratory system, strengthening those areas. Then in, also you have to practice the more other types of the Shatkarma, like Shank Prachalana is very good. But again, there's lots of precaution, and these practice you should learn through the guidance, under the guidance of the guru and the teacher, not by watching on the YouTube or from the net. Okay. Then meditation. If there is a kapha, if asthma is in the kapha personality, so they can go for the anapan. Okay. Anapan you can introduce to them. The passive meditation is very working for them. Passive meditation you can introduce to them. But if there is a vat and pith along with the kapha, then you can introduce a little bit passive and active. Like you can start with the active meditation, like chanting the mantras, and then taking towards the um, another form, the silence, taking to the 3S state. So silence completely going taking to the silent state. That's mix of the active meditation and which leading towards the passive meditation. That technique you can introduce. Yoga Nidra is also effective for we're gonna practice that thing in the meditation class. So Yoga Nidra is also effective for these people who are having, even Vata people can practice the Yoga Nidra because they have the insomnia issue. So before going for sleep, they can play the Yoga Nidra session. Many videos, audios are available on the net. Any videos which you like most, you can play it, and then you can go for the sleep. So Yoga Nidra can be introduced to them as well. Then chanting meditation, yes. Japa meditation is very ideal rather than chanting loud. Japa meditation is not in your course because online is very difficult to teach you. You require the offline session for that. So in Japa meditation, you are chanting but within yourself. So that kind of meditation also you can introduce. So these all are the problems which we have, gone through. Mm, asthma, upper and lower respiratory. I have told you any problem, even in the COVID situation, same thing. In COVID situation, breathing, most of the breathing you have to practice. That is the diaphragmic breathing, abdominal breathing. Even today, modern doctors start talking about that. You have to lie down on the prone position and then do the breathing. It's very much common if you get the your oxygen is, level is going down. It's gonna increase immediately the oxygen level in your body. So breathing, yes, 15 to 20 minutes, all the breathing. I have keep telling you, breathing practice plays very important role in order to heal yourself. Any kind of problem, you have to do more breathing practice. So this is all about the Vat, Kapha, and the Kapha Pitta related issues. So any doubts till here? Any queries which you want to ask?
The yoga nidra is the
Hmm.
same as shavasana.
No. Not Shavasana. Shavasana is the asana, and Yoga Nidra is practice and during in the Shavasana. So for Yoga Nidra practice, you require the Shavasana, but Shavasana is not the Yoga Nidra.
So
Okay.
for you won't do shavasana, no, in yoga nidra, like relaxing all the muscles and everything after us asan.
Mm. In Shavasana, you have to relax all the muscles and everything. But Shavasana is like silently you are doing to yourself. Okay. But in Yoga Nidra, we have the many version of the Yoga Nidra. In tomorrow class, you come to know. Tomorrow we're gonna practice the Yoga Nidra. Don't worry about it. And then you get the idea about it. What is the Yoga Nidra? But yes, Yoga Nidra practice in the Shavasana. Shavasana is a asana. You relax your body, you lying down. But in Yoga Nidra, there's instruction, there's imagination include, there's breathing. You are not, you are relaxing, but through the another tools. So more things you're gonna add on, right? So
Okay.
Savasana is the asana only. Okay.
Okay.
Okay. So okay, let's end the session with the one time Om. Coming to the keep your back neck straight, aligned, and gently close your eyes. Take a deep, long breath. Exhale, inhale, exhale, inhale for the Om. Om. Shanti, Shanti, Shanti. Join your both palms, rub your palms, place on your eyes. Very slowly while thinking, looking at your palm gently. Open up your eyes with a great smile and say Om Shanti. Shanti. Bye bye. Meet you at meditation class. Take care. Om Shanti.
Om Shanti.
Om Shanti.